Hi, my name is Livia Fry. I'm a lifelong Connecticut resident and unfortunately a survivor of abusive teaching practices in one of our state's teaching hospitals. Last year, I, along with grassroots organization Warriors Care, launched a Change.org petition asking Connecticut legislators to support legislation that would require direct and informed consent from patients in our state's teaching hospitals before their bodies can be used for practice pelvic or rectal exams by medical students or trainees. We were overwhelmed with the amount of support this petition received. To date, it's gotten over 106,000 signatures, which, as it turns out, equals over 2,300 pages of signatures. To give you a sense of what people, including many of your constituents, are saying, we've made you a short video here highlighting some of the top comments that are representative of the concerns that our signatories are expressing.
I recently encountered such a test and was not asked if they could, and I did not know why it was being done. It is awful to be violated, as if I do not have a voice over my own body.
As a rape victim, this is haunting.
I have never been assaulted like this, and I truly hope I never will be. However, I know people who have, and it truly breaks my heart. No human deserves this to happen to them, ever.
I'm a retired physician who trained in Australia. We learned to do pelvic and rectal examinations on consenting adults. This is completely unnecessary and frankly egregious. I am appalled. This must stop.
Many of them expressed that they would be okay allowing students to practice. They understand students have to learn, but they would feel violated if they conducted these practice exams without obtaining consent first.
As a retired healthcare professional, I recognize the right of every patient to be treated with respect, to be protected from unnecessary procedures, and to be informed of what may be done to their body when they are unable to consent.
I am an undergraduate pre-med. Hearing about this made me disappointed in healthcare culture. It's a lot like the issue with Henrietta, who was a black woman who had a tissue sample taken from her ovarian cancer without her consent. I think these non-consensual pelvic examinations are a vestige from the time period and need to be removed from healthcare culture. I have never liked when you're in a hospital and the doctors just bring in training students and don't even ask for your consent for them to be present, like a person doesn't have rights.
They actually had the nerve to say that they don't want to ask people for consent because they would say no. Doesn't that tell them that this is totally wrong on every level?
The unpleasant and uncomfortable truth is, every day this legislation is left pending in Connecticut, our state's residents are being denied their right, our right, to safe and dignified healthcare. We are asking you, our legislators, to please step in and protect us so that we can access healthcare, knowing that our dignity and our agency over what happens to our own bodies will be respected.